విశాఖ ఎంవిపి మెడికేవర్ హాస్పిటల్స్ మరో అరుదైన వైద్య ఘనత సాధించింది. ఆంధ్రప్రదేశ్, తెలంగాణ రాష్ట్రాల్లో తొలిసారిగా పెర్క్యూటేనియస్ ఇమేజ్ గైడెడ్ రీనల్ ట్యూమర్ క్రయో అబ్లేషన్ చికిత్సను విజయవంతంగా నిర్వహించింది. సీనియర్ కన్సల్టెంట్ ఇంటర్నేషనల్ రేడియాలజిస్ట్ ప్రొఫెసర్ డాక్టర్ దేవర అనిల్ కాశీ విష్ణువర్ధన్ నేతృత్వంలోని వైద్య బృందం ఈ అత్యాధునిక చికిత్సను విజయవంతంగా పూర్తి చేసింది. కిడ్నీలోని ట్యూమర్ను పెద్ద శస్త్రచికిత్స లేకుండానే చిన్న చర్మరంధ్రం ద్వారా ప్రత్యేక క్రయోప్రోబ్తో అత్యల్ప ఉష్ణోగ్రత వద్ద గడ్డకట్టించి నాశనం చేయడం ఈ చికిత్స ప్రత్యేకత. ఈ విధానం ద్వారా ఆరోగ్యకరమైన కిడ్నీ కణజాలాన్ని సంరక్షించడంతో పాటు నొప్పి, రక్తస్రావం తగ్గడం, ఆసుపత్రిలో ఉండే సమయం తగ్గడం, రోగి త్వరగా కోలుకోవడం వంటి ప్రయోజనాలు ఉంటాయని తెలిపారు. ఈ చికిత్సలో డాక్టర్ గొర్లి దివ్యరాణి, డాక్టర్ సాయి పద్మిని మహాపాత్ర, డాక్టర్ వి చెన్న కృష్ణారావు, అలాగే అనస్థీషియా విభాగాధిపతి డాక్టర్ రాజశేఖర్ కీలకంగా సహకరించారు. మెడికేవర్ హాస్పిటల్ సెంటర్ హెడ్ డాక్టర్ అరుణ్ కుమార్ మార్గదర్శకత్వంలో ఈ అరుదైన వైద్య ఘనతను సాధించారు.
To this event which has been planned, I am Professor Dr. Devara Anil Kashi Vishnuvardhan. I am a senior interventional radiologist working as head of the Department for Radiology and Interventional Radiology at Medicare Hospitals MVP. I am just representing my team along with my radiology and interventional radiology colleagues and anesthesia and critical care team. Today we are here to announce a milestone in the treatment of cancer, which is renal cryoablation, which we performed at Medicare Hospitals MVP for the first time in Andhra Pradesh and Telangana. Renal cryoablation is a minimal invasive image guided percutaneous procedure we do for treatment of renal tumors by placing the thin linear needles which we call as cryoprobes. Once we place the cryoprobe within the tumor under CT scan and ultrasound guidance, then it is connected to the cryoablation machine which pumps argon gas and nitrogen gas into the tumor, causing destruction of the entire cancer. Now coming to the patient, this patient whom I am talking about is a 72-year-old male who came to us with a left renal tumor of 3.5 centimeters with comorbidities of diabetes mellitus, hypertension, mild coronary artery disease, left ventricular hypertrophy, and a history of acute kidney injury in the recent past. Now, there were two options which were given to this patient, either to go for laparoscopic or robotic surgery and cryoablation. The patient and the relatives were very keen on getting renal cryoablation done, which we did. And as I told you, we connected the cryoprobe to the cryoablation machine, and then with argon gas pumping through the tip of the needle forms an ice ball within the tumor, which leads to complete destruction of the tumor. And this entire procedure was done under mild IV sedation and local anesthesia. The immediate post procedure was absolutely uneventful. Patient was comfortable and we were able to discharge the patient on the second day. So there were no complications related to the procedure and absolutely uneventful. So coming to the benefits of renal cryoablation, it is an procedure which is done through a pinhole. So there is no scalpel used, there is no cutting, it's absolutely scarless, it is less traumatic, less painful, it helps in quick recovery, and the most important part, it is nephron sparing, where you are able to preserve a large part of the kidney, which may not be possible with surgeries. And it is also possible to do renal cryoablation in patients who are aged. I mean patients above 80 years who are not fit for surgery or who have undergone surgery and who have developed a recurrence. And in those patients, a redo surgery or a surgery which has to be done again is quite difficult. In those cases, renal cryoablation can play a very significant role in treating the cancers. Also, in those patients where they are not fit for surgery, or else they don't want to undergo surgery. In those patients, we have modalities of renal cryoablation which can be done to cure the cancer. So the bottom line is the renal cryoablation and interventional oncology which we have started here in APM Telangana is going to change the paradigms of interventional oncology and the cancer treatment in the days to come. And say that it is going to change the entire way we look at it as a cancer treatment. And in the end, I would like to thank my colleagues in radiology and interventional radiology who have immensely supported, and along with the anesthesia team, without which we cannot successfully perform the procedure. Thank you. And we have given our side of the picture as to what we have done as a team and how we have tried to cure a patient with the kind of a situation the patient was and the kind of a situation we were. And now we have to hear it from the patient and the patient's relative. Here the patient's son is available and he will give us the his experience of undergoing the procedure at Medicare Hospitals MVP. So I would like to invite Mr. Srinivas, who happens to be the son of the patient. Please, Srinivas.
Members, the respected doctors, and the Medicover team. I am Srinivas Bomali, the son of Vijayanand Bomali, who is 72 years old, has undergone cryoablation on June 11th, 2026. When we approached Dr. Anil Devara sir for the particular treatment, the way he explained the procedure and the level of confidence he has given to us for the particular treatment is exceptional. And the moment he said the cryoablation is one of the best and safest procedures available in the worldwide market, we were very happy about it, and it made us easy to give go ahead on the particular treatment, as we know the condition of our father. Today it's almost 2 months the procedure, the support with the support of Medicover and its entire team, we were very happy to say that my father is recovered well and is doing fine. We are deeply thankful to Dr. Anil Devara sir, the entire medical team, the maintenance staff, the nursing staff, the insurance team, and of course the Medicover Hospital Vizag for their excellent care and support. And additionally, we would like to thank our dear friend and well-wisher, Dr. Harin Kumar from Srikakulam, who's been continuously giving support to us. Thank you once again for giving me the opportunity to share my experience here.
Anesthesiologist, Medicover Hospitals, Vizag. Once a 72-year-old patient with renal cell carcinoma, once the radiology team has approached us for the requirement of anesthesia and all. So once we have gone through the patient's conditions and all, we thought this would be the best. So with minimal sedation, we could avoid the complications of general anesthesia, which are associated with laparoscopic or others. So with this, we planned on minimal sedation with total intravenous anesthesia, which went on well, with which we could avoid major complications.